What if I told you that subtle changes in your body could be warning signs that your pancreas may need attention? The pancreas plays a crucial role in both our digestive and endocrine systems, impacting everything from how we digest food to our blood sugar levels. Ignoring its distress signals can lead to significant health issues, including specific conditions such as acute or chronic pancreatitis. Today, we're going to uncover 12 early signs that your pancreas might be in trouble. Now, let's explore these signs and what they could mean for your health. 1. Abdominal pain. Abdominal pain, a common symptom of various abdominal issues, including acute pancreatitis, typically manifests in the upper belly and can extend to the back, intensifying post-meal. This discomfort arises from the pancreas's inflammation in acute pancreatitis, which can be triggered by various factors including gallstones, excessive alcohol consumption, certain medications, infections, or physical trauma. Effective diagnosis of pancreatitis usually involves blood tests and imaging scans that help confirm the inflammation and assess the pancreas's condition, but these require careful interpretation by healthcare professionals. Understanding these symptoms and their potential linkage to pancreas health is crucial as they can escalate quickly, leading to severe health complications if left unchecked. Urgent medical care is critical to determine the precise cause and appropriate treatment plan, ensuring timely management of the condition. Early detection and treatment are key in preventing the progression of pancreatitis and maintaining overall digestive health. To learn more about the medical insights into abdominal pain as a symptom of pancreatic disease, you can explore additional information through reliable medical sources online. 2. Nausea and vomiting. Experiencing nausea and vomiting can be more than just an unpleasant ordeal. These symptoms are often telltale signs of pancreatitis. When the pancreas becomes inflamed, its ability to function properly is compromised, leading to digestive disturbances that manifest as persistent nausea and repeated episodes of vomiting. Such symptoms are not only discomforting, but also contribute to a significant loss of appetite and potential nutritional deficiencies if prolonged. These gastrointestinal signs are common in both acute and chronic forms of pancreatitis and warrant a closer look by medical professionals to prevent further complications. Typically, a person with these symptoms might also experience other related issues, such as abdominal pain, fever, and a swollen abdomen, all of which are indicative of acute pancreatitis. A healthcare provider might suggest a series of diagnostic tests, including blood work and imaging scans, to confirm the diagnosis of pancreatitis. Recognizing these signs early and seeking prompt medical consultation can greatly improve the management of the condition and prevent serious outcomes. Addressing the underlying causes, while important, typically requires medical interventions for treatment and prevention of further episodes. For a further detailed insight into how such symptoms relate to pancreatic health, reliable medical resources online can offer valuable information and guidance. 3. Fever and chills. When the pancreas is inflamed, as in acute pancreatitis, fever and chills are common symptoms, which are symptoms of the body's response to inflammation and can occur without infection. However, these are general signs that could be related to various other conditions as well. This immune response elevates body temperature and can cause shivering, which helps to increase body heat in an effort to fight off the perceived threat. The development of fever and chills can vary in intensity, often indicating the severity of the inflammation. Medical professionals use these symptoms as key indicators to evaluate the progression of the condition. Inflammation can cause the body to react in ways similar to fighting an infectious agent, even though the cause may be non-infectious, like alcohol abuse or gallstones. To diagnose and assess the extent of pancreatitis, doctors may rely on a combination of physical examinations, blood tests to measure levels of digestive enzymes, and imaging studies such as CT scans. The presence of these symptoms, while uncomfortable, serves as a crucial alert to seek medical attention promptly. Urgent medical attention is crucial to prevent complications such as systemic infection or further damage to the pancreas. Handling these symptoms early with appropriate medical care not only helps mitigate the immediate discomfort, but also plays a pivotal role in the overall treatment and recovery process. 4. Tender and swollen abdomen. A tender and swollen abdomen is a hallmark of pancreatitis, where inflammation of the pancreas leads to discomfort and pain. This swelling is primarily due to the pancreas reacting to injury or irritation, swelling not just the pancreas itself but also affecting nearby tissues in the abdominal cavity. The tenderness is a result of the abdomen being sensitive to touch, a direct consequence of the inflammation and swelling. Patients often report that this tenderness worsens when lying down and may feel somewhat relieved when leaning forward or curling into a fetal position. In medical practice, this symptom is critically observed as it can signal the need for immediate treatment to manage inflammation and prevent severe complications. Doctors usually perform a series of diagnostic tests, including physical examinations, where gentle pressure is applied to the abdomen to evaluate pain response, alongside imaging tests like ultrasound or CT scans that provide visual confirmation of inflammation. Additionally, blood tests are conducted to check for elevated levels of pancreatic enzymes. Managing these symptoms quickly with medical intervention is crucial, as prolonged inflammation can lead to more serious conditions like cysts or necrosis of the pancreas. Therefore, recognizing and responding to these symptoms early is critical to prevent severe complications like pancreatic necrosis or pseudocysts. 5. Diarrhea. Diarrhea in cases of pancreatitis can also result from an enzyme deficiency, among other factors in pancreatitis, significantly impacting the body's ability to properly break down and absorb nutrients from food. This inefficiency in digestion leads to undigested food passing quickly through the intestines, which manifests as frequent, watery stools. The presence of diarrhea not only causes discomfort, but also poses a risk of dehydration and nutrient deficiencies, making it a concerning symptom that requires attention. Patients may notice an increase in the frequency and looseness of stools, often accompanied by a sense of urgency and abdominal cramps, which can affect daily activities and overall quality of life. In medical assessments, doctors look for this symptom as a critical indicator of digestive function and the severity of pancreatitis. To confirm a diagnosis, healthcare providers may recommend stool tests to measure fat content, which may be used in cases where the diagnosis is uncertain. Along with stool tests, comprehensive blood tests, and imaging are used to evaluate the health of the pancreas and guide treatment options. Addressing diarrhea is important not only for comfort, but also for preventing more serious issues like dehydration and malnutrition. Chronic diarrhea can lead to significant dehydration and substantial weight loss if not managed properly. Treatment typically involves dietary adjustments, hydration, and enzyme replacement therapy is typically required and crucial for managing chronic pancreatitis to aid digestion, all aimed at managing symptoms and improving nutrient absorption. 6. Fat in stool. When the pancreas is compromised, as in pancreatitis, its ability to produce and secrete sufficient digestive enzymes is impaired, leading to what is known as malabsorption. One of the most telling signs of this condition is the presence of fat in the stool, medically referred to as steatorrhea. This occurs because fats from ingested food are not properly broken down and absorbed, instead passing through the gastrointestinal tract largely intact. The result is stools that are often oily, unusually foul-smelling, and may appear lighter in color or even float on water. Recognizing these changes in bowel movements is crucial, as they can indicate that the pancreas is not functioning properly. For a definitive diagnosis, doctors may recommend a fecal fat test, which measures the amount of fat in the stool. Additionally, imaging tests like CT scans or MRIs might be used to assess the pancreas directly for signs of inflammation or damage. Managing fat malabsorption typically involves dietary adjustments to reduce fat intake, coupled with enzyme replacement therapy to aid digestion. This approach helps alleviate symptoms, improves nutrient absorption, and prevents further complications. Prompt and effective treatment is essential to restore digestive health and ensure that patients can maintain a normal, active life despite their condition. 7. Indigestion. Indigestion is frequently experienced by individuals suffering from pancreatitis, where the inflammation of the pancreas impairs its ability to aid in the digestion process, leading to discomfort and a decreased appetite. This symptom is characterized by a persistent sense of fullness soon after starting a meal, abdominal bloating, and often a burning sensation in the upper abdomen. Such digestive distress is not only uncomfortable, but also disrupts normal eating patterns, which can further exacerbate nutritional deficiencies. The underlying cause, a deficiency in pancreatic enzymes, means that the pancreas isn't releasing enough enzymes to break down food, especially fats, effectively. To confirm the link to pancreatitis, healthcare providers often perform tests such as blood analysis to check enzyme levels and imaging tests like ultrasound or CT scans to view the pancreas directly. Treatment strategies typically focus on managing the symptoms and supporting pancreatic health. This may involve dietary modifications to ease the burden on the digestive system, medication to reduce acid levels in the stomach, and enzyme supplements to aid in food breakdown. Such measures are essential not only for alleviating the immediate discomfort of indigestion, but also for preventing potential complications from poor nutrient absorption. Addressing indigestion promptly enhances overall digestive health and improves the quality of life for those affected by pancreatitis. 8. Signs and symptoms of malnutrition. Chronic pancreatitis often leads to malnutrition, a serious health concern that stems from the pancreas's failure to secrete enough digestive enzymes, crucial for breaking down food and absorbing nutrients. This deficiency results in malabsorption, where the body does not receive adequate nutrients from the diet, leading to weight loss and a general decline in health. Malnutrition in this context can manifest in several ways, including fatigue, muscle weakness, and a decrease in muscle mass. Individuals may also notice changes in hair and skin condition, such as hair thinning or skin becoming dry and flaky. These physical signs are critical indicators that the body is not receiving the nutrition it needs to function properly. To diagnose and manage malnutrition caused by chronic pancreatitis, medical professionals typically conduct a thorough assessment, which includes nutritional blood tests to check for deficiencies in vitamins and minerals, along with detailed dietary evaluations. Treatment often involves a combination of nutritional supplements and pancreatic enzyme replacement therapy to aid digestion and absorption of food. Addressing malnutrition effectively is crucial not only for alleviating these direct symptoms, but also for preventing further complications that can arise from prolonged nutrient deficiency. Effective management thus plays a pivotal role in improving patient outcomes and maintaining overall health in those affected by chronic pancreatitis. 9. Rapid pulse. A rapid pulse, frequently observed in acute pancreatitis, is a significant symptom that reflects the body's acute response to both inflammation and pain. This increased heart rate is part of the body's natural fight-or-flight response, initiated by the release of stress hormones like adrenaline, which prepare the body to handle immediate threats, in this case, inflammation. However, it is important to consider that a rapid pulse can be due to various causes and should be evaluated in a broader context. A rapid pulse can be particularly concerning because it may strain the heart, especially if it persists. Patients experiencing this symptom might also report feeling lightheaded or short of breath, symptoms that require immediate medical intervention. In a clinical setting, healthcare providers use the presence of a rapid pulse along with other symptoms to gauge the severity of pancreatitis. They may perform tests such as an ECG to monitor heart function and blood tests to assess levels of inflammatory markers. Managing the underlying inflammation effectively is crucial, as it can help stabilize the heart rate and reduce the risk of complications. Treatment typically involves medications to alleviate pain and reduce inflammation, fluids to prevent dehydration, and sometimes interventions to address the root causes of pancreatitis, such as gallstones. Early and proactive management of symptoms like a rapid pulse is vital in treating acute pancreatitis, helping to ensure better outcomes and prevent serious health issues. 10. Weight loss. Unintentional weight loss is a significant concern in chronic pancreatitis, often a result of the pancreas not producing enough digestive enzymes, which leads to malabsorption of nutrients. This condition means that even though individuals may be eating regularly, their bodies cannot absorb the necessary nutrients from their food, leading to a deficit in caloric intake and subsequent weight loss. This symptom is typically gradual and may be accompanied by other signs of malnutrition, such as weakness, fatigue, and a decrease in muscle mass. In cases of chronic pancreatitis, weight loss can become a persistent issue, affecting the patient's overall health and quality of life. Medical professionals often use this symptom, alongside others, to diagnose and assess the severity of the disease. diagnostic approaches include fecal tests to check for fat in the stool, blood tests for nutrient deficiencies, and imaging tests to evaluate the structure and function of the pancreas. Addressing weight loss involves treating the underlying pancreatic insufficiency with enzyme replacement therapy, which helps improve nutrient absorption. Dietary modifications and nutritional supplements may also be recommended to ensure adequate nutrient intake. Managing this symptom effectively is crucial, as proper nutrition supports the body's ability to combat inflammation and promotes healing, thereby improving outcomes in chronic pancreatitis management. 11. Oily, smelly stools. Oily, smelly stools, medically known as diarrhea, are a common symptom of chronic pancreatitis and signify a problem with fat digestion due to insufficient pancreatic enzyme production. These stools often appear greasy and can float in the toilet because fat is less dense than water. The smell is typically much stronger than normal due to the presence of undigested fats. This condition arises because, without enough enzymes, the pancreas cannot break down fat effectively, leading it to pass through the digestive tract largely unchanged. The consequence is not only unpleasant symptoms, but also significant nutritional deficiencies, as fats are a major source of energy and vital for absorbing fat-soluble vitamins. To diagnose this issue, doctors may conduct stool tests to quantify fat content and check for other digestive disorders. Addressing oily, smelly stools involves managing the underlying enzyme insufficiency through pancreatic enzyme replacement therapy, which helps restore normal digestion and absorption. Diet changes, like reducing dietary fat intake and eating smaller, more frequent meals, can also alleviate symptoms. Successfully managing these aspects is crucial for improving quality of life and preventing further health complications associated with chronic pancreatitis. Regular follow-ups with healthcare providers ensure that treatment adjustments are made as needed to maintain digestive health. 12. High blood sugar levels. High blood sugar levels, often associated with damage to the pancreas, are a critical concern in individuals with pancreatic disorders such as pancreatitis. The pancreas plays a pivotal role in regulating blood sugar by producing insulin, the hormone responsible for helping cells absorb glucose from the bloodstream. When the pancreas is damaged, its ability to produce insulin may be compromised, potentially leading to an accumulation of glucose in the blood, a condition known as hyperglycemia. This can progress to diabetes, but not all cases of pancreatitis result in high blood sugar levels. Symptoms of high blood sugar include increased thirst, frequent urination, fatigue, and blurred vision, which can significantly impact daily life. Diagnosing this condition involves blood tests to measure glucose levels, with continuous monitoring that may be necessary for managing diabetes resulting from pancreatic damage. Treatment typically focuses on lifestyle changes such as diet and exercise, along with medication to help control blood sugar levels. In cases where pancreatic damage is extensive, insulin therapy may be required. Managing high blood sugar effectively is crucial, as it not only helps alleviate immediate symptoms, but also reduces the risk of long-term complications such as cardiovascular disease, nerve damage, and kidney issues, thereby improving overall health and quality of life. We've just walked through the crucial signs that indicate your pancreas may be in distress. Remember, recognizing these early symptoms can be your best defense against serious pancreatic diseases. If you found this information helpful, don't forget to like, subscribe, and click the bell icon for more updates from Edge of Health. We're here to keep you on the cutting edge of what your body is telling you. Stay tuned and stay healthy.